All right. Good morning. Good morning to all of our panelists and everybody watching on Zoom and Facebook. Thank you so much for joining City and State's State Legislative Forum for Manhattan and Staten Island. I want to first of all thank our sponsor, AARP New York, for helping us put this on. And thank you especially to our panelists, these lawmakers who are joining us today to talk about what the rest of session looks like. There's about a month left. The budget is behind us, but the second big rush of the legislative calendar is coming up soon, where everyone is working to get their priorities in before the end of session and before summer and the primary elections come up. So, looking forward to talking to everybody about those priorities. We're going to be hitting on topics like the COVID-19 response, high prescription drug costs, retirement security, long-term care reform, affordable housing, and really whatever else comes up. I'm Jeff Coltin, senior reporter at City and State, and my privilege to MC today, to host. But with that, I will jump right in. I'm going to have our panelists actually introduce themselves, but with a prompt. And for those who watched Morning Joe this morning, or were on Twitter this morning, you may have seen that Mayor de Blasio announced that he wants New York City to fully reopen on July 1st. That means no more restrictions on restaurants, on stores, on arenas. Yankee Stadium can be filled up again on July 1st. Of course, the mayor can't do this on his own. There has to be some authorization from the governor and possibly from the legislature too. I'm not even sure. But luckily, I have a whole bunch of legislators with me here today. So I'm going to ask to go around and give me, I guess, a little bit of reaction, each of you, to that breaking news. And let me know if you think that opening on July 1st is a good idea, whether you have any concerns about that date, whether it should be sooner, later, whatever. And I will start. I'll start with the top of my screen with Assembly Member Rebecca Seawright. Please briefly, tell us your name, where you're from, and your thoughts on the reopening. You're on mute. Sorry.
See here. I'm Rebecca Seawright, proud to represent parts of the Upper East Side of Manhattan and Roosevelt Island, and glad to be here today with you, Jeff, and Kevin. And I want to thank City and State and AARP for hosting this session today, and particularly focusing on senior citizens and COVID. It's great to join all of you and to see my colleagues again. I think in terms of the response of opening on July 1st, we have a very visible active storefront office on York Avenue and 79th Street and a mobile office on Roosevelt Island. And what I'm hearing from my senior citizens is that they're still having housing issues. The senior citizen centers are closed, and that they're having access to services because of COVID and the closures. And so I think getting our senior citizen centers open, our nonprofits up and running, will be a benefit to the senior citizens that walk into my office every day needing help with services.
Fantastic, thank you. Over to Assembly Member, who's next on my list, Michael Reilly. Please introduce yourself, let us know where you're from, and give us some reopening reaction.
Jeff, thank you for having me. I'm glad to be here as a member of the panel. My name is Michael Reilly. I represent the most southern district in New York State, Assembly District 62 in Staten Island. I've been a member of the legislature since 2019, so I'm currently in my second term. I'm enjoying working with my colleagues from both sides of the aisle. I just want to make sure that everybody understands that I really enjoy us working on policy issues. And when it comes to the COVID-19 reopening, I think we're making some very good inroads. Yesterday was a good start where we actually rescinded one of the governor's executive orders that I think many of us agreed with, that it wasn't really based in science, where we removed the requirement that bars had to serve food with alcohol. So I think we're taking a good approach, where we're really thinking before we act, and I appreciate that, by especially from the majority, because they're actually moving forward with some ideas that many of us have spoken about. When it comes to reopening by July 1st, I believe that that's a target that we can hit. I personally would prefer it to be a little sooner, but there are some challenges that we want to make sure that we address. And I think since it was announced today, I think we'll actually wait for more information to come out, because how often have we heard announcements and then 3 weeks later we're still waiting for details? So I'm going to be optimistic, but cautiously optimistic. But once again, thank you for having me today, and I appreciate being here.
Thank you for joining. And yes, thank you for being our one representative from Staten Island today. Assemblyman Charles Fall was going to join, but cannot. He sends his regrets. With that, I want to throw it over to Assemblyman Dick Gottfried.
Well, good morning. So little introduction. I represent Chelsea, Hell's Kitchen, a little piece of the Upper West Side, and a lot of Midtown in the state assembly. I've been in the assembly forever, having been elected in 1970. You know, when you find a job you love, you'll never have to work a day in your life. You know, I chair the health committee in the assembly, but I am always very mindful of the fact that while my professional degree has a D in it, the first letter is not an M, it's a J. I've never, you know, I have literally been inside a medical school, but not as a student. I think we're lucky in New York that both the mayor and the governor, even when they're at each other's throats, have both tried to guide policy on things like closing and opening based on the best science available. And there are many states in the union that can't say that. There are many countries around the globe that can't say that. I think we need to move cautiously. If the medical science indicates that by July 1, it is safe to open everything up, I'm all for that. You know, I've been as, you know, cramped and cranky about the shutdown as probably as anybody. But I also cherish the ability of me and my family and my constituents to live a long and healthy life. So I'm glad the mayor is getting advice in that direction. It's a very good sign. I hope as we go forward, that continues to make good scientific sense. But if and when it turns out that that's not such a good idea, kind of like they found out in India, we had better be prepared to pull back.
Thank you very much. Over to Assemblywoman Deborah Glick.
Thanks so much, Jeff and Kevin, for leading us through this discussion. I just want to say that I'm very proud that I've had a several decade opportunity to represent the fabulous 66th Assembly District, which is much of Lower Manhattan from the Hudson River to First Avenue, below 14th Street, Soho, NoHo, Tribeca, East Village, West Village, and a little bit of Battery Park City. The issue of whether or not we should reopen and whether a particular date is the right date has been a discussion that's been ongoing. You know, it's 2 months away. July 1st is 2 months away. In theory, that should be fine if we can up our vaccination rate. But of course, you know, even with the CDC saying that in uncrowded outdoor areas, you can be without a mask, obviously you still need to be masked indoors. And that may be the case for some period of time. Once we reopen, you know, it's about how many people come in who are fully vaccinated. If people are visiting from other parts of the country that have had a very low vaccination rate, we don't know. So I think that while I am anxious, like everyone, spring fever and, you know, with it, the allergies, really call us to be out and about and enjoy all of the things that we've been missing, from museums and theaters, movies, parks. We've been enjoying parks except in the dead of winter, but you know, this is something that is still a little bit nerve-wracking, particularly since, you know, the most recent conversation was, how long will your vaccination last? So I'm glad that I wasn't vaccinated in the first round. So I feel like I have a little more lead time here, but I'm excited for the possibility of a full recovery, and look forward to hearing where my colleagues are on this. Thanks so much.
Thank you. Over to Assemblyman Robert Rodriguez, please.
Thank you, and thanks for having me, and thank you, AARP, for hosting this important panel. I think what viewers are going to get here is, this is a little taste of what conference is like when we talk about issues like this. This is exactly how it goes. So, you know, I think it's great that we're having this dialogue, and I would say I think that July 1st is a goal. And I think it's very important for us to look at the science and think about how we do that. And I point directly to vaccination rates, right? I represent East Harlem and Barrio, and communities are not accessing the vaccine in the same rates in different communities. We have a great amount of work to do in terms of hesitancy. I think in terms of vaccinations, we do hit a point where we start to plateau and have to work even harder to get people to get vaccinated. And as in representing one of those communities where, you know, we have work to do and have trusted partners who are going out there and really try to work through some of the hesitancy issues, some of the concerns. The J&J news did not help. You know, as we start to get that back online, you know, we have to make sure that when we open up, that communities, all communities have reached a point where the vaccinations, you know, are representative of something as significant as a full reopening. So I'm going to be looking at that closely, and I think, you know, many of our seniors, some of whom who are homebound and are still in the process of getting vaccinated, you know, hear things like, you know, July 1st and say, well, wait a minute, I'm still at home waiting, you know, to be vaccinated. So I think there's significant work to do in this area, but there's no question that economically, we all want to see that happen. You know, quality of life, seeing people, our hearts, you know, really want that to happen. But the variants are real, and people are getting sick. And I'll just share a quick personal anecdote. Right during budget, you know, half of my family, you know, ended up being positive, and the other half was negative. And we did everything right. Didn't go anywhere for spring break. You know, staying home. My wife was half vaccinated, and still, you know, you can be positive and fall ill, which is kind of, and this is April, right? So we are not there. We're not out of the woods. We're still trying to get there between now and July 1st. And we can all look at it, watch the numbers, and do the work and see where we are at that point. But I think we still have to be cautious about how we do that, because there's a lot of people that are still not vaccinated without even their first dose.
Thank you. And I hope your family members are all back to full health now. We're
all good now, but we were fortunate. Thank you.
Mm-hmm. Over to Assemblywoman Carmen De La Rosa. Introduce yourself and reaction to that breaking news of a potential July 1st reopening date.
Thank you, Jeff and Kevin and AARP, City and State, for having us. I'm Carmen De La Rosa. I represent Upper Manhattan, the communities of Washington Heights, Inwood, and Marble Hill, which is debatable if it's in the Bronx or in Manhattan. We can have that conversation another time. But I will say that I agree wholeheartedly with what my colleagues have said here so eloquently, specifically what Assemblymember Rodriguez just said. Our communities are similar in demographic and in health outcomes. And there has been a lot of hesitancy as far as the vaccine. We also know that in my community, for example, they discovered one of the new variants, and that has been something that has been awfully scary for our communities. Parts of my district have been at 10% positivity rate for a long time, and we're just finally starting to see it begin to come down. I think that the July 1st goal is something that gives people hope. Our small businesses have been impacted heavily with all of the closures, and starting to see it come back alive is inspiring and a positive light. I will tell you my perspective as a mother. My daughter is 6 and she just started her first day of school this week after a year of being here in remote learning with mom and dad as her teachers. So I'm sure she's very happy. She's actually already showing signs of being excited and coming back to life. And so for me, that's a positive. And we're gonna follow the science. We're gonna make sure we're doing our due diligence to follow and see what is happening with the variants across the city, and making sure that we have vaccine sites all across our city and in our communities that are hardest hit is important.
Thank you so much. Over to Senator Brad Hoylman.
Hi, Jeff. Good to see you, Kevin. Good to see all my colleagues, especially the ones I overlap with, which is always nice to see. State Senator Brad Hoylman, I represent 72nd on the west side down to Canal Street, and on the east side, 56 down to 3rd Street. Unfortunately, there are a lot of cutouts though along the way, so I don't have the entire swath. But it's a really good question. And Jeff, I really think that we, meaning New York State, and frankly every state, could use a lot more guidance from the federal government. The federal government has the data. Andrew Cuomo and the health department say they're reviewing vaccine safety, and they say they've looked at the J&J shot to see whether it's safe or not. The truth is they just don't have the data or the expertise to make these assessments. So to the extent that the federal government can, like they did earlier this week about mask wearing and outdoors, provide us that guidance, I think the better. It is true though that so far every variant is compatible by all the vaccines that are available. So the concerns about variants right now should be ebbing if we get our vaccination rates higher. Only about 50% of seniors are vaccinated at this point overall, although 65% of those 75 to 84 and 71% of those over 65 are vaccinated. So the numbers are stronger in the younger seniors, but homebound seniors, there's still a lot of work to do. 23,000 remain unvaccinated. So until we reach those folks, I think, there's going to be concern all the way up until, July. For my district, which has the theater district, July is not going to be the opening. The mayor said this morning that he doesn't see Broadway fully opening until September. And, that's a lot of jobs. That's a lot of union jobs. That's a lot of productions. So until I see those Broadway lights blinking, I'm not going to feel that New York or New York City or my district is fully open.
Thank you. And over to Senator Brian Kavanagh.
Great. Thank you. Add my thanks to City and State and ARP for hosting it. My district is Lower Manhattan and also a good chunk of Brooklyn. So this is my second opportunity to be on a borough-based ARP City and State call, but it's great to be back. Maybe I can be a regular, on these things. My colleagues, I think, have said it well. I think in the short run, it's going to be kind of a false distinction whether New York is open or New York is not open. I think we're going to have to make decisions about different activities as the data changes. So for example, this week we're considering in Albany a bill that we're likely to take up on Monday that will extend the moratorium on evictions and foreclosures. That's evictions of tenants, both commercial and residential, foreclosures of homeowners, small landlords, small businesses, and also that includes tax foreclosures and tax sales as well as as mortgage foreclosure. And we have chosen the date of August 31st as the date to extend that to. And that is based on our assessment of what the CDC is saying about eviction specifically as a driver of COVID transmission. And it should be noted that, during this last stage, hopefully last stage of this pandemic, we have to keep two things in mind at the same time. We have to both, I think, be optimistic about the future, hopefully about the near future, things getting better. But we also have to, at the same time, we're feeling a little more positive about the future. We have to understand that we're still in the midst of a pandemic with very high rates of COVID transmission. The CDC updates those numbers once a week. New York State is still considered statewide to be a place where there are high rates of transmission. There are only a handful of counties in the state that don't have a high rate of transmission. There's only one that has a low rate of transmission, that is Hamilton County, which has a total of 4,800 people spread over an entire county, which is kind of like taking a large housing complex in New York and spreading it over many, many miles. So, it's a little easier to be safe in that context. But, we have a lot of work to do, and we need to make sure we keep our guard up even as we look toward the future.
Thank you so much. And over finally to Kevin Jones from AARP. If you could introduce yourself, and hey, I'm wondering too if you have a reaction to the July 1st reopening.
Yeah, well, first of all, thank you, Jeff, and thank you to all the Assembly members and senators on the panel today. We really appreciate it. It's a very stressful time, and that you're on these little cameras all day. So we really do appreciate you taking the time to join us. And in terms of reopening, I think that we think of it a little bit differently, similar to what Senator Kavanagh said. We think of it more in terms of we support following CDC guidelines on very specific issues. So whether or not that would mean that the city is all the way open is not as important to us as some specific activity and what the parameters of regulations around that activity might be. So that's the first thing. And the second is that as the CDC guidance changes, because we just saw changes this week, and it's probably going to change over the next few weeks as more people get vaccinated. It's important that we keep in mind what the logistics are and what logistics are required, I should say, in order to ensure that the 50 plus are able to access the services from the state and the city that they really need, because the delivery of those services has been had to be adjusted as we go here based on what the scientific requirements are in terms of keeping everyone safe, particularly for the 50 plus, who has that's the group that's really been just devastated in terms of serious illness and death through this pandemic. And I want to just touch on one thing that Assemblymember Rodriguez said that we also think is very important, and that we've been pushing on the governor's office for a couple of months, and that's the need to have a coordinated statewide plan for vaccinating the homebound. Because we know there's been a lot of challenges, particularly with the J&J pause, but that's going to be key in order to get those folks protected.
Thank you so much to Kevin. And I neglected to mention this at the beginning. I want to remind the audience that we will be taking audience questions. I see a few in the Zoom Q&A, and I see a few in the chat too. Please, if you have a question, put it in the Zoom Q&A so I can run through those and ask our lawmakers near the end of this hour. But briefly, I just want to touch upon what Kevin just said there. Look, the vaccinating homebound seniors, but also just, the vaccination program in general. I know that this is, largely, kind of locally run. It's also state run. There's a mix of things. In the remaining month here, does the state legislature have any role in, getting these vaccines out? I guess, structurally, does the state legislature have any role? I know that also in your offices, certainly there's a lot of constituent outreach and making sure that that people can get vaccinated there. So I'll open that up to anybody who has thoughts on increasing vaccine outreach and making sure that we reach this threshold sooner.
Well, I would say
one
Jeff,
thing I would
Deborah,
one thing I would say is that when the federal government started to send resources directly to pharmacies, as opposed to having people trying to access state sites, which was very complicated. Lots of people, there's a digital divide. Lots of people did not have the ability, especially older people and people in communities of color, to navigate that. And so I think the vaccination rates went up once pharmacies, which are locally based, started to get the vaccine. And that, I think, has been the biggest help. These large sites where you needed to, travel to, a lot of people didn't want to get on a subway, or in other parts of the state didn't want to drive an hour and a half. So I think that continuing with our local pharmacies is probably going to be the best way. And once senior centers are open, which I know our current borough president, Gail Brewer, has pressed for, that may be another mechanism for ensuring that we reach more people, people who are connected to those. And we have groups like Visiting Neighbors or God's Love We Deliver. They should be involved because they're on the ground with people who are homebound.
And I'll add, Jeff, that it was the legislature that allowed pharmacists to vaccinate individuals with the COVID shot in the first place. So I'm proud that we did that. And the legislature, narrowed the vaccine exemptions for school children 2 years ago. I'm sure you remember during the measles outbreak. We need to consider doing the same thing once the COVID-19 vaccine is proven safe for all school children. I think we're going to be seeing a demand for that. And we're going to have to stand up to the anti-vaxxers once again, just like we did 2 years ago, and just like New Jersey tried but failed to do after we narrowed our vaccine exemptions. We're going to have to look at things like the reality of vaccine passports, and whether, for example, we're going to propose a mandate on college students to be vaccinated, and other employees. That's the truth. I think that it's a hard truth, and it's going to be something that New York and other states are going to have to face, because those requirements are mandated at the state level.
As we continue, I mentioned pharmacies. I want to, talk about a few specific bills that are being considered in the, remaining time of session. Specifically, a bill about curbing high prescription drug costs that I know ARP is particularly interested in. There's a bill proposed in at least the state Senate that would prohibit pay for delay agreements between brand name drug manufacturers and generic drug companies. And look, I know this has been also a big issue around the COVID vaccine, but I think it's more than just the vaccine issue. It's about all prescription drugs. Wondering, who here has some thoughts on that bill, whether anybody here is supporting it or has reservations, and whether Go ahead.
The so-called pay for delay bill is an important one. Major drug companies, when they've got a drug that is soon going to go off patent, they go to the generic drug makers and they say, instead of you selling our drug as a generic at a low price, in order to keep our prices up, we will pay you money to not produce our drug as a generic. Wildly anti-consumer activity. And there are a couple of states that have passed legislation that has survived court challenges to do that, to prohibit that kind of contract. I'm planning on introducing the same bill that's now in the Senate to do that here in New York. There's a lot legislatively that we can do about prescription drug prices. Pharmacy benefit manager companies, PBMs, are central to the whole marketing of and selling of drugs in ways that practically nobody really understands. They siphon off an enormous amount of money that doesn't go to that goes neither to the insurance company, who is nominally their client. It doesn't go to save consumers money. It goes into the pockets of the PBM. We've been trying for years to get strong legislation passed on regulating PBMs. And shockingly, Governor Cuomo has vetoed it. We're going to take another stab at it this year. And of course, on prescription drugs, as with almost every issue in healthcare, to me, the fundamental problem is how we pay for healthcare. And doing that through a fragmented, profit-based system of insurance companies makes it impossible for us to bargain effectively with drug companies, and not only produces higher drug prices, but higher prices for healthcare in general, largely because so much money goes into insurance company administrative costs and profit, and doctors and hospitals spend an enormous amount on administrative costs to fight with the dozens and dozens of insurance companies they have to deal with.
I would just add that it was great to hear the president last night say that there was going to be a change federally, and that the prohibition on Medicare actually negotiating for drug prices was terrific. And I think we'll go, that's going to be a fight. But if we're successful at the federal level, that will help downstream. But one of my biggest annoyances is the direct-to-consumer marketing of drugs. At the end of all of these advertisements on TV, there is this little thing: tell your doctor all the drugs you're on. Presumably, you're getting them from someone who's writing a prescription, and there should be consistency in your medical records so that people can see what you are in fact taking. That is spending an enormous amount of money on direct-to-consumer marketing that should be going into research and development and lowering prices of drugs in general.
Jeff, I would like to touch on it, that the benefit management, the prescription benefit management companies. I think that's something that we all agree on, that, or I think we all agree on, that we should be revamping it and really improving services for customers. I wanted to share just one example in my own personal life with my wife. She has rheumatoid arthritis, and for many years, she was it was debilitating to the point where she couldn't even brush her own hair at some points, and I had to do it. This is something that's near and dear to my heart. She was on this injection, and forgive me, it was a few years back, and I can't remember the exact name of it, but she was on this injection, and it was really helping her. And all of a sudden, my prescription drug plan maxed out my family benefits in 4 months. So therefore, she had to come off that medication. My kids and myself were capped as well for the remainder of the year. So just to see the impact. I mean, I know firsthand how the cost of medicine really hurts families and hurts our communities. So I'm open to definitely revamping that and helping our consumers and helping families just like mine suffered. And there's so many more that are suffering even more than what I endured. But just to give you just a taste of that, the prescription, I didn't realize it was they were being billed $2,500 each prescription, and she was taking one every week. And I couldn't believe how much that drug was costing. So, just to be able to share just my own experience, I think will help others. And I'm sure there are others that have so many more issues like that. But thanks for all the efforts.
We'll have to recruit you to sign on as a sponsor on the New York Health Act. We'll talk offline about that.
We'll talk offline.
Look, on the topic of healthcare delivery, I do want to also ask about home healthcare. We do have a question in the chat that's asking about comprehensive reform in the delivery of home healthcare, and asking basically what to do about how to create a system that includes the underpaid and underappreciated home health aides. And I got to say, look, I get 1,000 emails every day, but one of them yesterday really caught my eye. It was from the Chinese American Planning Council, and it was talking about ending the 24-hour rule in New York State home care. And this was just something that I didn't know about. And I still don't know the technicalities of it, but something about a 24-hour workday and being paid for a 24-hour shift, which I've pulled an all-nighter before, and it's horrible. And I'd like to hear more about this. So I'm wondering who here has some thoughts about how to reform the home healthcare system, and also if you could clue me in on what the 24-hour rule is.
I can do that. By the way, reforming the home healthcare system is primarily a question of paying home health aides decent salaries. The 24-hour rule, I still can't believe this happens in America. If you work as a home health aide for a 24-hour shift, which some do, and there are a lot of home health care patients who need round-the-clock coverage. My mother did, but she had 2 12-hour shifts. There are some who work a 24-hour shift. And that's enough of a burden. But what's outrageous is that our law allows those workers to be paid for 13 hours of work during that 24-hour day on the theory that they are allowed to spend some time with meals and some time sleeping. Now, you might say, well, if you're sleeping, why should we pay you? Because you're sleeping at your work site, number one, and number two, you are obligated to spring into wakefulness and help your patient, at a moment's notice. So people are getting paid 13 hours of basically minimum wage for extremely difficult work when they are expected to be at their workplace and ready to work at a moment's notice for 24 hours. It's been litigated. It's been upheld in the courts. We've got to do something about it.
I like to add to that. I absolutely agree with Member Gottfried, as I often do. But I have to say, my mother was a home health aide. And I remember the grueling hours as I was raised. She would have to literally make breakfast, run to her shift for her client, pick us up from school, make something to eat, and go back. These are grueling hours. I want to say that this is a workforce that is made up of predominantly women of color, immigrant women who come from communities that are already at the low level of the wage gap. And this is adding to the income inequality that we see in our city and wage parity issues with women in the workforce. The hours, as I said, are grueling. This idea that women or workers would sleep, and therefore that would count towards this 13-hour of unpaid work is ridiculous, should not be happening in this time. And it's definitely necessary for us to pass legislation. I will say that as Member Gottfried also noted, the wage scales vary greatly depending on which agency you're assigned to. So some may make $7 an hour, $8 an hour, some make $15 an hour. There's a lot of variation as to what wages are paid. And also at a drop of a hat, you can be told as a home health aide, don't come in today. There has been a complaint filed against you because, sometimes we have people who are on the health spectrum and they need certain type of care. And if they're not happy with the care that's being provided, they'll say, don't send them in. So at a moment's notice, they can be told to go home. They lose those hours of pay. And so we definitely need to reform this system. There's a lot of issues here. I know that our colleague, Harvey Epstein, has a bill that deals with the 13-hour rule. And I'm looking forward to taking on that conversation. The New York Times did a great piece on this last year, and I'd encourage everyone to look at it. It also talks to the spectrum of care. When we look at what's happening, from early childhood education to early childhood care to caring for seniors, home health aides are an important part of that spectrum of care. And so we have to reform that in New York, not only for the workers, but also for the people that are receiving that care. There aren't a lot of options for people who are navigating this system and want a certain level of care as well. So it's a deeper conversation, but I'm glad it was brought up here today.
Yeah, and Senator May has a bill that she carries. She carries Assemblymember Gottfried's bill, which is a good bill in terms of the minimum wage for these workers. And we also have to think, Jeff, about the clients. You know, better wages are better for the patients. And at the end of the day, you know, both parties are so important. And clearly, this pandemic has exposed so many needs and given the strongest argument for the New York Health Act and overall reform of our healthcare system that one could ever imagine.
Yeah, and I just want to add one thing to that. Oh, sorry, Assemblymember. I just wanted to say that we also, AARP supports a career ladder for home health aides because we think that that will attract more workers to the field and actually provide them opportunities for advancement, which to Senator Hoylman's point, you know, the better people you can keep in this field, the better that is for the patients.
I just wanted to reinforce what my wonderful colleague, Assemblymember De La Rosa said, that this is largely impacts women. Women live longer, so they are more often the clients. They are women of color, immigrant women who do the work, but they also have children, and childcare is extremely expensive, non-existent, and they are, again, squeezed as workers because they're if they have young children who haven't gone to school yet, they are really in a bind. So I think that the society has to make a dramatic change and look at caregiver support, whether it's for seniors or for young children. And we have paid very little money to the people who do that work because the people who do that work are largely women and frequently.
Look, I want to talk about another issue that's certainly affecting aging New Yorkers, retirement security. I know that Assemblymember Rodriguez has a bill that would create a secure choice savings program, or maybe improve its just secure choice savings program. Want you to talk about that bill so we can hear a little bit more.
Sure. So it's called the Secure Choice Savings Program, and it's a program that has been actually rolled out in a number of states. And I think when we initially proposed this idea in 2018, this is when California and Oregon and some other states were Illinois were beginning to roll it out. And we are now, at the point of seeing their programs come online. When we created this in 2018, the concept is really simple. There's about 3.5 million New Yorkers in the state of New York who do not have access to any kind of retirement savings program. And we know that the best kind of retirement savings programs are those that are provided by the employer. When they take a little bit of money out of your check, that is, and it goes straight into a savings account, whether it's matched or not, it is the best way for an individual to be able to save. And when we are, many of us on the call have that, it happens, we budget around it, we don't think about it. And then at the end of the day, you've got a reasonably large nest egg. But this should be available to everybody, whether you make a little bit or whether you make a lot. It's something that needs to be made available. So in 2018, we created this voluntary program on paper, right? We passed it in the budget, created the foundation for a board to move ahead with it and for it to get implemented. Unfortunately, there hasn't been any real action on it. And we think now is the time to take the steps necessary to make it fully implemented and robust. And when I say robust, I say we had created this voluntary model. And if anybody knows anything about saving, that's the status quo. Everything is voluntary right now. I can go create an IRA account in a voluntary method, but that doesn't help people in the same way. If it's not employee based, it says you are 15 more times to participate in a savings program if it is provided by your employer. And so not only do we have an opportunity to provide this to millions of New Yorkers that are earning across the wage scale. This should not just be those for, who are, in higher paying, higher earning jobs, whose companies have, nice programs and packages making it available to them. It should be available to everybody. And we're making sure that it is a mandatory requirement for small businesses that have more than 10 employees. I want to be clear. It doesn't cost you anything to offer this. All you have to do is enroll your employee in the state-run savings program. You don't have to pay for it. You don't have to match it. The employer doesn't have to incur any costs to do anything other than, in the same method that they pay their employee and do other deductions for, Social Security and other ways, that they make that they press that button to make the allocation for their employees. So we're going to, in this legislation, make it a requirement for small businesses with 10 or more to enroll in the program, and the employee has the option to not participate. That will change the way that people save. That will make sure that at the end of the day, we are able to see something. And I just referenced back to California because when we looked at them, we wanted to at least be in the group, but they have actually rolled it out. And they have close to 244,000 people, and this has just come online, who are now saving. They have about 28 million in savings that have already been amassed, which is on average about $114 a month for individual. So it's not big, and we're not talking about big savings, but that money is going to grow. And at the end of the day, they're going to have more than what they started with. They'll have a small nest egg, to be able to rely on, in addition to Social Security, in addition to, if you're lucky enough, to have a pension, to do that, or in addition to 401ks if you are lucky enough to get this. But the good thing is it's a portable program. So anywhere you work in the state of New York, many jobs, small jobs, if you move from one employer to another, you're able to continue to do the saving along the way. So I'm looking forward to being able to pass that, this session and have the support of AARP and many of my colleagues already on the call, to be able to get this done in the way that we should have in 2018. But, the clock is against us at this point. We've lost 3 years. Let's try and get this done as soon as possible.
Yeah, I just want to add that, AARP supports any legislation that increases the opportunity for people to save for retirement. So we want to thank Assemblymember Rodriguez for his very tireless work on this issue. As he said, 3.5 million private sector workers having no way to save for retirement through their employer. It's just, it creates a really bad situation for folks trying to retire and stay financially secure. So we will be encouraging Assembly members to sign on, and as senators as well, to sign on to support these bills. Particularly the move from it to require all employers to participate, and making it an opt-out for employees instead of making them proactively opt-in.
And I just like the mention of what California's doing. I think a little bit of state rivalry is always a good motivator to get things happen and get things moving.
That's a good point. When we started this, we wanted to be in the first 5 or 10. Right now, we're firmly in the middle. We're going to be like the 20th state to do it. So we don't want to be bringing up the rear. So let's just to bring up that rivalry issue. Don't let Texas beat us. That's bad.
Hey, we've got a couple Texans on the call. All right.
Yeah, it's fine. It's fine. It's a friendly jab is fine.
Look, we're running out of time. I do want to hit on a few more issues. As the end of session is approaching, I know that criminal justice issues are always being considered, and it seems the big push this year is around parole reform and this bill about releasing aging people in prisons. If any of you are working on that bill, I'd love to hear an update. What's the latest in the criminal justice space?
Well, my colleague, Assemblywoman De La Rosa, and I carry a bill that would allow those who are incarcerated at age 55 or older who have served at least 15 years the opportunity for an automatic parole hearing. that's so important, Jeff, because we have 10,000 elderly and incarcerated New Yorkers behind bars who are basically serving a death sentence because they are unlikely to be released before they do pass. And that is the sad reality, particularly given so many health problems for this aging population. We're hoping to move that, right, Carmen?
Yes, absolutely. Thank you, Senator Hoylman. And, you know, many of us that are members of the Corrections Committee have visited prisons during this time of COVID just to see what's happening there. I have to tell you that one of the most heartbreaking scenes that I witnessed was a man who was being read his final rites at Fishkill Correctional Facility while we were there. He was literally on the phone with his family saying goodbye. He could not move. He could hardly speak. He was in an isolated room, and he was in prison and would have remained in prison for his natural life. And so, you know, this person is not a harm to anyone and should receive the dignity of being able to say goodbye to his family in person. I believe firmly that everyone is capable of transformation, and that at a bare minimum, being able to come before the parole board and to show that transformation. If this is a system of correction and not punitive and perpetual punishment, then they should be given that opportunity. I know it's a controversial issue. It's an issue that we will be discussing, but Fair and Timely has already passed the correction committee in the assembly. We're looking forward to see elder parole do the same, and then it's going on to the codes committee and hopefully to the floor before the end of session.
This also makes me think the past two sessions have seen bail reform and then reform to the bail reform. I don't actually know. I mean, is there any proposal of a further reform this year, or is the issue mostly off the table for 2021? And you know, for anybody who's aware, you can answer that question.
Jeff, I'll take a little, I guess, stab at it. I know that we may not, us here on the panel may not agree on all the topics that we discuss when it comes to criminal justice reform. We may come from different entry points in our philosophy and where we stand on certain issues. But I think it's clear that there's always room for improvement. And it's something I've mentioned myself debating on the floor in the assembly. And when it comes to bail reform, I do think there are some more adjustments that need to be made to the original bail reform. I think that we made some inroads with some fixes in the last part of last year's session. I still think there is room to make it better, where we can actually, like I said, there is always room for improvement. And some of the things that were done in the original bail reform, I could support. I really think that there's for the lower level crimes, we can have some meaningful changes, and we've seen that happen. But there are some issues that derive from it. So I think it should be an ongoing conversation, and I actually think that I think that way about many of the pieces of legislation that we discuss in the legislature. I don't think it should be a one and done. I think we should always be looking at things that we pass, things that we discuss in committees, things that we pass in both the chambers. And, you know, as times move forward and times change, there's always room for us to fix things that we may have, there may have been issues that went overlooked. And I think that's something specifically with bail reform that I think really needs to be done. And, you know, I think we can come to a point where we meet on common ground, and it's something that we can all live with. And I'm hoping that we can have those discussions even more.
Thank you. Another question from the audience is asking about standards for nurse and caregiver ratios in hospitals and nursing homes. I believe that's the safe staffing bill. And the question is basically asking for comments on the legislative issue and the prospects for the legislation in the remaining time we have. Any comments on safe staffing?
Yeah, we have now a bill for safe staffing levels in hospitals and a bill for safe staffing in nursing homes. They have been broadly agreed to, certainly in the legislature. I expect that we will pass both of those bills in the assembly this coming week. And I hope they will become law very quickly. They're long overdue.
Yeah, this week I've been hearing about this for a very long time. This is one of those issues that's always in my inbox. So that I guess we asked the question at the right time.
The Health Committee held its first hearings on safe staffing in 1996.
Yeah, that's half your career, I believe. That's really something. Other questions from the audience that I just want to get to. One person is wondering the thoughts on the DOH's proposed cutting of community-based home care providers. Wondering if anybody has thoughts on that issue.
I think that's the consumer-directed home care program. Yeah, the Cuomo administration a year or so ago essentially bullied the legislature into passing legislation that will severely restrict that program. This year, we were able to push back a little bit without going into too much detail. It's a superb program, very popular, which is largely why the administration hates it, because they don't like spending money on Medicaid. We have to keep pushing to protect the consumer-directed program.
Mm-hmm. Oh, sorry. In the remaining time, I just want to give you all, in 15 seconds, keep it brief, a priority of yours for the rest of session. About a month left. I'll start with Assemblymember Seawright. Any final priorities that you'd like to mention that have not been mentioned before?
I chair the Assembly, thank you, the Task Force on Women's Issues. And so we've identified some priorities. The Equal Rights Amendment is still not in our New York State Constitution. And we've passed it several times in the Assembly, but it hasn't passed the Senate. And so I think finally getting around to passing this, it has to be passed in two different consecutive sessions and then put before the voters as a referendum. So I think that is a priority. During Women's History Month, had a 106-year-old feminist came to my office, and she's asking to volunteer in our office at age 106. And she said she would like to see the Equal Rights Amendment passed at the state level in her lifetime. So we need to get it done this session. And again, Jeff and Kevin and my colleagues, I want to thank you for having me today, join you on this important series about senior citizens and legislative priorities. Thank you.
I watched that TV show Mrs. America about the Equal Rights Amendment on the federal level. I'm thinking I got to talk to this 106-year-old. She seems like she'd be could star in a TV show, maybe.
She's a dynamo, and she's a sex therapist. That was her career. She's a psychologist and has written books, and she's amazing.
The secret to living long, maybe. It's fantastic. Look, we don't have time for everybody else, but just wondering if anybody else would like to jump in very quickly with final legislative priorities.
Well, I have a bill called the LGBTQ Long-Term Care Residents Bill of Rights, because LGBTQ seniors are unfortunately treated differently in long-term care facilities. And my Robocall Prevention Act, which thank you AARP for your support over the years, trying to finally get that across the finish line.
Mm-hmm.
Well, I'm following up on our speed cameras in school zones by working with advocates on crash victims' Bill of Rights. Obviously, older people tend to frequently be, unfortunately, victims, pedestrian victims.
I just want to mention one additional priority that AARP has, which is the legislation for accessory dwelling units to really help with the housing issue. And I meant to thank Senator Kavanagh earlier for all of his work on housing and the moratorium earlier. I didn't want to go without mentioning that as well.
Mm-hmm.
Pass the New York Health Act.
All right, with that, I will say thank you so much to all of our panelists, to all of our viewers who joined as well. Want to say that we're going to be having another AARP, the State Legislative Forum, this one focused on Brooklyn. Maybe Senator Kavanagh will join next Thursday, May 6th at 10 a.m. The registration is in the chat. That's free, of course. On May 18th, City and State's going to be hosting our annual Digital New York webinar for those of you who are involved in tech and digital and broadband issues, all of that. That's also free website. Check the website for more details. And way on in June, we're going to have a New York nonprofit OpCon. So any of you involved in nonprofit operations, that's always a great community at those events, and a lot can be learned. So thank you again for everybody who joined us today, and thank you especially to our legislators and to AARP for co-sponsoring this. So glad to hear from all of you about your priorities for the rest of session. So again, I'm Jeff Coltin from City and State, and thanks for joining.